Today, we're going to step inside the pediatric emergency room to really understand a critical truth. Kids are not just small adults. It's so much more complicated than that. Their bodies are different, their needs are totally unique, and the way you care for them in a crisis has to be highly, highly specialized. So let's dive in and find out why.
Okay, I want you to just imagine for a second. You're in that ER. The lights are way too bright, there are all these jarring sounds, and your child is sick or maybe they're hurt. What is the single biggest fear that's racing through your mind? It's a question that the medical staff in there has to face every single day.
Well, it turns out that beyond the actual injury or the sickness itself, the most overwhelming thing for both the kids and their parents is the fear of the unknown. I mean, think about it. The suddenness of it all, the completely unfamiliar place, the rapid-fire questions, it's just enough to completely short-circuit how we normally cope with things.
So the very first job for the medical team is to cut right through that fear. And that brings us to our first section, calming the chaos. This is all about how the staff builds trust and creates a sense of order in a super high-stress environment. And they often have to do it in just a few minutes.
You know, we've all heard that saying, silence is golden. Well, not in an emergency. In an emergency, silence is absolutely terrifying. This quote really gets to a core principle of pediatric care. To a worried parent, silence can feel like the staff is hiding bad news. And that's exactly why constant, clear updates are such a top priority.
And you know what? They have to build that trust. And they have to do it fast, using a few simple but really powerful tools. And I want to be clear, this isn't just about good bedside manner. Communicating calmly, making eye contact, using the child's name, and being honest, yep, even about a procedure that's going to hurt a little, these are actually clinical tools that they use to reduce fear and get cooperation. That trust really becomes the foundation for everything that follows.
And a huge piece of that puzzle. It's about keeping families together. These days, parents are seen as partners in their child's care, not just visitors. You know, their presence is often one of the best ways to calm a child down, which in turn helps the medical team get a much more accurate assessment. And this, right here, shows you a huge shift in thinking. Having family in the room is now officially recommended in every single phase of emergency care. Okay, so once that trust is there, the team can move on to the next critical phase, the critical first look. This is where a trained professional can figure out an incredible amount about a child's condition, sometimes before they even lay a hand on them.
And it all kicks off with something called the first impression triad. It's basically a super fast, hands-off assessment that helps nurses immediately get a sense of just how sick a child might be. It's all about 3 key observations.
All right, first up, breathing. And we're not just talking about how fast they're breathing, but the effort involved. Is the child using extra muscles just to get a breath in? Are their little nostrils flaring? Or can you see retractions where the skin actually pulls in around the ribs? All of those are signs of serious difficulty breathing.
Next, number 2, what's their skin color? You want to see a nice, healthy pink. But what if it's pale, or mottled with a kind of lace-like pattern, or even bluish? Any of those colors is a huge red flag that there could be a problem with their breathing or circulation.
And finally, number 3, how is the child responding to everything around them? You see, a healthy kid is usually alert, they're making eye contact, but a kid who's really anxious might be struggling to breathe, and a child who's limp, who's just not interested in anything, well, that could mean respiratory failure or even shock.
So after that initial first look, the team dives into the primary assessment, the classic ABCDs of emergency care that you might have heard of. It's a more hands-on, systematic check. And for kids, that very first letter, A for airway, is where things get really, really different.
Just take a look at this comparison here. A child's airway is just smaller. It's narrower, their tongue is proportionally way bigger in their mouth, and the whole structure is softer and more flexible. So what does all this actually mean? It means that a tiny bit of swelling or mucus that would just be a minor annoyance for you or me could completely block a child's airway.
All right, this leads us to a really critical topic. You might even call it the climax of our journey through the ER, recognizing the red flags for shock, which is one of the most serious and life-threatening conditions a child can possibly face.
So, what exactly is shock? Well, when you boil it all down, it's basically a delivery problem. For whatever reason, maybe fluid loss or an infection or a problem with the heart, the body's tissues just aren't getting the oxygen they need to survive.
Now here's the really scary thing about shock in children. The early signs, they are so subtle. A child's body is incredible at compensating, at trying to fix the problem on its own. This is why nurses are trained to be detectives, really. They're looking for these tiny clues,
a heart rate that's just a little too fast, cool skin on the hands and feet, or maybe a child who just seems agitated or unusually worried. Catching these early signs is absolutely crucial.
Okay, if you take away only one thing from our entire conversation today, let it be this. In children, low blood pressure is a late sign of shock. A kid can actually compensate for losing up to a quarter of their blood volume before their blood pressure finally drops. So by the time that number drops, they are already in deep, deep trouble.
So let's put it side by side. It makes it super clear. On one side, you've got a stable child. They're pink, they're warm, they're alert. But then you look at the other side and you see all those warning signs we've been talking about. The mottled color, the cold skin, and that scary shift from being irritable to just lethargic. Those are the signs that the body's defenses are starting to fail.
You know, seeing all of this, the intensity of it all, it really brings us to our final section. And honestly, it might be the most important one. After seeing what happens in an emergency, how do we try to avoid it in the first place? Let's talk about the path to prevention.
So why do I say prevention is the most important part? Well, look at this. The #1 cause of death and serious injury for children in the US isn't some rare disease. It's unintentional injuries. In other words, things that we can almost always prevent. But here's the good news. The ways to prevent these things, they aren't secrets. They're well known and they are incredibly effective. Using car seats correctly every single time, making helmets a non-negotiable part of riding a bike, locking up medications, and just being hyper-vigilant around water. It sounds so simple, but these actions literally save lives.
And that really leaves us with one final question to think about. Because when you understand what's happening inside that ER, the fear, the science, the split-second decisions, it's not just about the medicine. It becomes your motivation. It shows you exactly what's at stake. And hopefully, it empowers all of us to use that knowledge to turn a moment of potential crisis into a lifetime of safety for the kids we love.